The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, a very important topic, hot topic, bioidentical hormone replacement therapy. With us, we have an expert on the topic, board-certified OBGYN, Dr. Paoletti. Dr. Paoletti, welcome to the program.
Hi, Randy.
You know, for people that don't know you, because we're talking about women's health, I guess you used to teach at UCLA?
Yes, I did. I worked with students, and I worked particularly with the residents at Santa Monica Hospital, teaching them how to do cesarean sections in those days and how to manage individuals after they've had surgery.
Now, OBGYN, but you have some serious endocrinology training.
Right.
With hormones. You've been around women's hormones for 40 years?
For 40 years, right. I've been working with hormones since I was 20.
And still today, you go to these conferences where all of the doctors are sharing information?
Right. I love conferences. I sit up in the front just like I did in medical school.
Is there that much more going on? I mean, do you know that much more from when I first talked to you 8 years ago? Is there that much going on in the world of hormones and hormones replacement?
There's a lot going on, but actually I'm learning more of it from studying and going to conferences on sleep, on the heart, on depression. So I'm finding myself going to these other specialty areas, and I'm integrating what I'm learning there into my own practice.
But are you developing, I don't want to put words in your mouth, but more of an appreciation about the power of what can be done with hormone optimization?
Yeah, and the art. I tell you, I can really tell who's going to do well, who isn't, and who's going to need a little bit and who's going to need much, much more. So it's almost like a instant sensing of what someone's
by listening to their symptoms, looking at their blood work.
And looking at their body. You can tell their body, their voices.
People that should know. I mean, you have some high-end, very well-known and famous people.
Right.
And I'll quote some. I mean, when you can't find out what's wrong, you send Dr. Paoletti to diagnose.
Yeah.
Is that?
Well, I am really good at finding out what's wrong. I do get a lot of people who've been a lot of different places, and I work at it. I'm good at it in that respect. Yeah, I am.
Now, what do they call what you do? I mean, do you call yourself holistic medicine, regenerative medicine, alternative medicine, anti-aging medicine?
Well, it's women's health in general, and it's very proactive, preventative medicine, I would say. Yeah.
Now, menopause. I invited you on the program, looking for an expert in LA, to talk about menopause. You know, some of the basics, and there's a lot to talk about it. You call it, mastering menopause. Elaborate on that. And, I mean, do you believe it's possible? And define menopause, by the way, for people that don't know.
All right. Well, menopause is when your periods stop. It's technically the very moment that your period stops, menopause. So it's a very difficult period in life to actually pinpoint. And then after that, there's the postmenopause, and before that, there's the premenopause. The only problem is saying postmenopause over and over again is a little tiresome.
Okay.
So we refer to menopause as the time after your periods stop. But you actually become low in estrogen far before your periods stop. So you can get sporadic periods, hot flashes, and things like that before the actual traditional definition of menopause. And it's really important to know that because treatment needs to start early.
Okay.
Yeah.
Now, we talked, and I said, what are your goals? I mean, I said, in a perfect world, who would come in? Because you deal with very sick people, too, right?
I do.
I mean, people with advanced stage disease, people that want to, prevent breast cancer, things like that. But ideally, you said you want to get people early on.
Right.
Early.
Yeah, I want.
So let's start there.
Yes.
When should somebody, a woman, and we're talking about menopause, do something about it or look into bioidentical hormone replacement therapy?
Probably, I mean, each one's different, but I would say in the early 40s, it's a good time, mid-40s, it's a good time to start informing yourself.
What are the first symptoms women have?
Hot flashes.
Hot flashes?
Memory
Are they always
loss.
at night, by the way, or they could be any time?
They could be any time, but they start off at night.
Okay.
Memory loss starts pretty early, too. You're going to notice a difference, I used to be able to tell you what page, what book, exactly where a quote came from, and I started noticing in my 40s that that was changing. You know, I wish I could go back and start estrogen then. You know, I know that a lot of the memory would be improved had I done that. But I mean, it's still...
So you had your own menopause story, obviously.
Yeah, I do, yeah. In fact...
So you had some real bad symptoms?
Really bad. I mean, probably worse than most of my patients.
Like what? Like what?
Well, the hot flashes. My hot flashes were nonstop, literally every 10 minutes. It was as if somebody had turned an oven on inside.
So when this
No
happens
warning.
traditionally with women,
Yes.
do they think maybe they're just depressed or having a nervous breakdown or what?
I think,
What do they tell you? I mean, what do they...
well, when it happens like that, I think they know.
Okay.
They do know. I think they recognize the flashes. But a lot of women don't have the flashes. They don't have that.
What do they have?
All they have is a sense of fatigue, growing fatigue, and maybe warmness. They start getting aches and pains, and their memory really
What about their
starts
moods?
to fade.
What about their moods?
Oh, they develop a melancholy. They lose sort of a hope.
Interesting. Like a zest for life?
It's zest. They take it down a notch. And even though a lot say they're fine, when they go back or when they start estrogen, they'll say, oh my God, I'd forgotten what it was like. And that I hear all the time.
To feel good.
To feel good again.
Is that right?
Yeah, that all of a sudden they feel like they used to feel. And that's something you can't convince anybody of before they go on it. And if someone's undecided, sometimes I'll just say, well, try it for a little while and see if you feel different.
Okay.
Yeah.
Now, you know that and for people just tuning in, we're talking about bioidentical hormones, bioidentical hormone replacement therapy, with an expert on the topic in Santa Monica. You've studied endocrinology for quite some time, and this is not an endorsement for you. But one of the things that that you want to come on the program and talk about is, you said that, and I'm paraphrasing here, but to talk about estrogen and the benefits of estrogen.
Yes.
And that because, going into this, and look, I'm doing as much research as I can, knowing you're coming on the program, and it seems that estrogen is bad, it's dangerous, it causes cancer, things like that.
Well,
is that what the word on the street is out there?
Yeah, that is the word on the street, and that is every woman's fear that comes in to see me. And I maintain that estrogen was the innocent bystander in a crime.
Really?
That basically it was there when the breast cancer occurred, but then so was Provera. So was this really strong progesterone. So the women who developed breast cancer took both estrogen and the Provera. But in that same study, when they took the estrogen alone, they actually had less breast cancer. And that's not well advertised. When they went back and looked at the women who took just estrogen and were compliant, there was 30% less breast cancer in that group.
Okay, so estrogen for women. Okay, so what's happening as you get older, 40, you start producing less estrogen?
Yes, you do.
Okay.
You produce less.
Is it kind of like what men have testosterone?
Yes, similar.
And the women have estrogen?
And the women have estrogen, right. So, yeah, I consider estrogen the oil in the engine for women. It is basically, all our systems are dependent on it. So our mood, our joints, our heart, our sugar, our memory.
But isn't the problem, and again, I don't pretend to be an expert at all on this,
Okay.
but isn't the problem estrogen dominance, too much estrogen already? Don't we already have too much estrogen?
No.
Maybe I don't understand this correctly at all.
I don't know who invented the estrogen dominance thing, but I think they may have been misogynist.
Okay.
No, but I think if all you are is taking estrogen, then obviously that's not a good idea. But you keep ovulating, and every time you ovulate, you make progesterone. And it's the estrogen that actually starts to decline. The progesterone stays there.
So women don't know this?
No, I don't think they do.
And there's a lot of bad press about estrogen?
Or they're told, they're told by their doctors that they have estrogen dominance, and here, let me give you some progesterone. But it looks like...
So progesterone, so I understand correctly, that offsets the estrogen.
Right.
And you're
so
saying
women,
that's a mistake or being overdone?
Like women have two basic hormones, estrogen and progesterone. You have to have both if you have a uterus. They have to be balanced because if you take just estrogen, you will develop uterine cancer, and that's not very desirable. So you have to give progesterone so that that doesn't happen. Because too much progesterone will tilt the scales in the other way, and you'll actually have a higher chance of getting breast cancer. So by shoveling progesterone on women, you're actually doing them a disservice.
Interesting. So are there a lot of these anti-aging doctors doing that?
Yes, there are. Yes, they just freely give progesterone in very high doses, in my opinion, and that's not in the best interest of women. And I think it's a very important thing.
How does your background, I mean, it seems obvious, but being an OBGYN, studying endocrinology, working with women's hormones for 40 years, but the OBGYN part, how does that equip you, you think? What insights does that give you to help better monitor hormones?
Oh, it's essential, because if anything goes wrong, which can happen, women can develop some spotting and bleeding when they're on the hormones, and how better to understand what's happening than to examine gynecologically, view the uterus with an ultrasound and tell, is this due to too much estrogen or too much progesterone?
Okay.
Yeah. Or did she develop a polyp or something else?
What else do we need to know about estrogen?
It's life-giving, okay? It looks like it reduces death due to all causes by 30% every 10 years of a woman's life in the menopause. And that translates into 300,000 deaths a year, 3 million over 10 years. If we can believe a couple studies that illustrate this, that's the impact that estrogen will have.
Okay, does your passion, by the way, that I'm picking up on, come from that there's a lot of women suffering that don't have to be?
Right.
And define suffering.
Well, they're out there, they're sweating, they're not sleeping. They're walking around, they tell me they feel like they're 80 years old, their joints are hurting, and they can't remember anything. And a lot of these women have high-powered positions. They're lecturing. They stop in mid-sentence. They can't remember the word, or they're intending to say one word, and instead they say another.
Wow.
And it's devastating for one's self-esteem again.
Is that right? Okay, so in Santa Monica, you get writers, directors, producers, actors, actresses, CEOs that, do they hit a wall? By referral, they come in, the memory's going.
Right. Usually something's wrong. You know, their job's starting to go bad. Their mood is affecting people. Their self-esteem, their confidence levels down.
And this is estrogen.
Well, that is estrogen, but also the testosterone in that picture makes a difference, because the estrogen and the testosterone often go together.
So you say, and you said this in our green room, that by getting them early, it's much easier.
Yeah,
like you say, those are easy. If I can get the menopause
the early women, the women that come in and say, boy, I just stopped having periods and I'm hot flashing like crazy, I love those women because they're so easy to treat.
Really?
Yeah.
Now, is there damage done to physiologically that when they do nothing, or maybe they do the wrong thing, or they're just taking birth control pills?
Right. The thing that happens is the longer they go in the menopause without estrogen, the more brain cell loss there is, the more bone loss there is, and some of that, if you let it go too long, isn't reversible.
Okay, so you're giving estrogen and progesterone together.
Yes.
But you're saying to not be afraid of estrogen.
Right.
Because I talked to some compounding pharmacists, without mentioning their name, that are really anti-estrogen across the board.
I know, and everyone's afraid to use estradiol, which is our true estrogen. Everyone seems to be out there giving estriol, which is a breakdown product. And the reason for doing this is really based in the belief that estradiol is bad for you. Okay. And it's not true. Estriol doesn't treat the brain. It doesn't cross that blood-brain barrier, and the receptors in the brain are made for estradiol.
Is that right? So this makes what you do challenging sometimes, depending on the level of hormone sophistication.
Oh, I know, it is.
They come in.
I know.
Because the camps are divided. I mean, when you go to these conferences where doctors from all over the country, and I don't know enough about it to really give an opinion here, but is it, do more people believe what you believe?
No,
It's about half and half?
I would say I'm probably in the minority, I suppose, because I don't think that many people in the field have spoken with experts and come from a background of gynecology and endocrinology. And there are often a lot of newcomers to the area. Everybody and their brother
they want
is
to come
getting
on my
into
program,
hormone
by the way.
therapy.
Right.
Right. And it's with, I think, not enough knowledge to do the best job.
I have plastic surgeons, dermatologists that want to come on my program. They want to do bioidentical hormones. And so, our new standards are, I want somebody that's been doing it a while because I don't know any better. In the old days, I would have interviewed anyone. But, and to say you're in the minority, the people that are well trained, because I've picked the brains of some of the people that are in charge of these societies, and they tell me that they give estrogen. And they're not afraid of it.
Right.
But there's a lot of women, which, I'm surprised, I don't know enough about it, but you're saying that don't be afraid of estrogen.
Well, it's true, and it's not just giving estrogen, but it's giving it in the right dose. Because they now have data showing what doses are necessary to optimize blood flow to the brain, to optimize blood flow to the heart. So it's not a matter of just giving it, because you don't know when it's enough. But for instance, the bone, I can tell almost immediately when someone's on enough estrogen to stop their bone loss. You want to give the right woman the right hormone at the right time, the right way, and the right dose. And you want to monitor it correctly.
You cycle this throughout the month?
Okay, some women cycle and some women don't, and I leave it up to them. There are some advantages to both ways. Like, I think in some cases the cycling may minimize some heavy bleeding, may minimize extra bleeding in one woman, but in another it can bring it on. So I leave it up to her. She decides, we see how it goes, and we can always change later.
So do you believe, women, they come to you with symptoms in the menopause. When a woman goes to you and your goal is to get them early, these symptoms stop or reverse. Is that true?
Yes,
Not
they
true.
do. They stop and they reverse to some extent. They don't take you back 10 years, but they will reverse.
So the memory
quite
improves?
A bit. Memory improves dramatically.
What
Mood,
else?
energy, sleep.
How soon do they start feeling better? Like mood-wise and memory-wise?
I mean, sometimes within an hour.
Are you kidding
I know it's
me,
hard
really?
to believe, but occasionally when someone comes in and they're really distressed, I will give them some estrogen right then and there.
Is that right?
And just, you can see the difference. Like within 15, 20 minutes, they'll smile. I mean, they can feel the difference. I don't do that very often, but I do under some circumstances when someone is very distressed. Because I feel like we can't even talk.
Really?
Yeah, it's that bad. I had one woman, she was in such bad shape, it took her almost 20 minutes to get from the parking lot to our office. She couldn't figure out where anything was. I mean,
Like
the
scattered all
hot
over the
flash is very disorienting. And they know that women with severe hot flashes have 20 times more chance of getting Alzheimer's.
Really?
So that the hot flash isn't just this little sweating and fun little thing that everybody thinks it is. It isn't. It's a serious depletion of oxygen to the brain. And that's what the hot flash represents.
How are hot flashes being handled today? And how do you handle it?
Oh, hot flashes are handled with a lot of fans. And I think women are trying soy and they're trying black cohosh and progesterone cream over the counter. And these things are...
Well, talk to these people, because women like this are watching the program.
Yeah.
What do you say to them?
That it's not going to work. It's not going to work. Sometimes the progesterone creams over the counter have a little bit of estrogen in them. So you might get a little bit of relief, but most of the time it doesn't help. It just doesn't help. If your flashes go away, it's probably because they were meant to go away, even without it. To be honest, no.
Why is estrogen good for the heart?
Why is it good? It lowers the cholesterol, for one, by 20-30%. And there's a particular type of cholesterol that when present in women, it increases the risk of heart disease by 3 to 4-fold. And this particular type of cholesterol isn't usually measured.
These are subfraction cholesterol?
Subfractionated cholesterol.
Okay.
Hey, and
Well, I had a Berkeley Heart Lab of myself, so I had to learn about these things.
All right. Okay. And
plus, I wanted to impress the audience that I know a few things.
So it's not improved by exercise, by diet, or even by statins. The only thing that makes your LP(a) go down into a safe range is estrogen.
Now, these are real interviews. For people watching this, this isn't planned. But am I going to have to put disclaimers all over the place? Results not typical? I mean, you're talking about, there's science backing up what you're saying?
I would say, oh, yeah.
Okay.
An average of 20% decline in LDL, the bad cholesterol. And there's the study when the Women's Health Initiative, that's that big study that made everybody scared to death to stay on estrogen. It did come out that heart attacks were decreased by 35% in the women between 50 and 65. And diabetes was decreased by 30%, colon cancer by 40%, and bone loss, fractures were decreased by 50%.
So we're talking, though, about bioidentical.
Right.
That means there's synthetic estrogens, and how are they different than what you're doing?
Well, for one, this is a misconception that a lot of people have, is that there are synthetic hormones and natural hormones, or the natural hormones are out in nature, such as Premarin is a natural hormone. It's found in horse urine. And so hormones from plants are natural.
Is that still the typical way women are hormone replacing?
Yes, but synthetics are bioidenticals. So you can make hormones, and you can make an artificial hormone, or you can make a bioidentical hormone.
So synthetic hormones are also bioidentical?
Yes, they are.
Interesting. Okay.
We make bioidentical hormones. We synthesize them. The only way for us to get them any other way would be to have a bunch of 20-year-olds in the back room all donating blood, and we harvest their estrogen.
Okay.
That would be the only way to get it. Other than
but
making
horse
it.
urine, like you say,
Yeah.
with what you're doing, that's not what you're doing.
No, I don't do horse urine. The other important thing is that you never give it orally, if at all possible. You want to give estrogen topically, because it will eliminate the big risk factors that they were claiming were associated with estrogen, such as stroke, heart attack, blood clots. If you don't give it orally, they don't happen any more frequently than women that don't take it.
I don't know how it's normally being done. Is it common that it's done orally?
Orally, yeah.
All the time?
Up until recently, and still now, quite a few doctors are giving it orally.
So it's a cream? What do you do?
Well, you can do a cream, a spray, a gel, a patch. There's a variety, depending upon women's lifestyle.
So some of these high-powered people that come in, they've been given great advice, and sometimes, so they're doing a lot of the wrong things.
Right.
And so you have to take a deep breath and kind of reframe what they're doing.
Yes.
Is that right?
Very gently.
And that's why your frustration, because you say, oh my goodness, Randy, estrogen.
Yes. I want to put a stop to some of the damage that's happening out there. It's very distressing. Especially when someone comes in and says, oh, I've been able to tough it out for 10 years. I stop myself from cringing, thinking of all the stuff that they've lost. Yes.
Stuff meaning what? Life experience?
No,
having a good time?
brain cells.
Oh.
I'm sorry.
Okay.
Yeah,
I thought we were talking about having a good time.
No,
and you're talking
that too. They unknowingly have lost a quality to their life that they weren't even aware that they'd lost. That's what's really sad. They don't even know it.
Wow.
Yeah.
Interesting.
Yeah,
Interesting.
They don't.
We're going to take a quick break. We come back. More about bioidentical hormone replacement therapy. We'll be right back. We are completely out of time. Now, for people just tuning in, we ended up getting, maybe it's my fault, stuck talking about estrogen.
Yeah.
But at your center, you look at nutrition, you look at stress, you do comprehensive testing.
Yes.
You do a lot of things.
Right.
It's not just about giving somebody estrogen in case they just tuned in.
No, it's a complete overview. So it's a complete history. I do pelvic ultrasounds, abdominal ultrasounds, rule out aortic aneurysm. I look at the thyroid. I look at their carotids to see if they're developing thickening of the arteries. Listen to the heart, lung, and then we do a variety of testing.
So you're doing all the hormones. You're looking at DHEA, testosterone, progesterone, and all of the things.
Yes. I look at all the hormones: thyroid, testosterone, DHEA, pregnenolone. the adrenals.
But your message is do something
Estrogen.
Early.
Yes,
But
and
do
do
something
it early.
And don't be afraid of estrogen.
Right.
Don't take it orally.
Right.
Aren't there 3 estrogens? I mean,
Yes, there is.
one
Yes,
do you take
there are.
orally or no?
One's estrone, one's estradiol, and one is estriol.
And none of those take orally.
None take orally.
And it's being done all the time. Millions of people are taking it
Yes,
orally?
they are taking it orally. Right.
Interesting. So they're going to have to, I guess, meet you to hear the whole story. This is a big topic.
Yes, it is.
And we're out of time. Final message, a woman, she has hot flashes. She's confused. She's taking over-the-counter remedies for her menopause. You say you could master the menopause, feel great, plus feed your heart, your brain.
Right.
What do you tell them? Final message.
Don't be afraid. It's going to change your life.
Okay, good. I want to thank you for coming in. Very interesting.
Okay.
Good
All
for
right.
you. Good
Okay.
for you. You've been watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like more information, or I should say, if you'd like to see this interview again, or show a friend this interview, you can visit our website at wellnesshour.com. Just put in bioidentical hormone replacement therapy, or BHRT, or Dr. Paoletti. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.